Hello everyone, I'm Dr. Matthew Reedy with Trillium Creek Dermatology, coming to you today with my colleague Dr. Wyatt Andrasik and our founder and medical director Dr. Helen Torok. Our final topic, we're going to be talking about acne, obviously a very common condition we all treat every day. Why don't we start with Dr. Torok? There are some misconceptions out there about acne. What are some of the common misconceptions that you hear on a daily basis?
So the most common thing is you see an older woman, right? 20s and 30s. I'm sorry, that's not older, that's young female. But they're over 20. Why am I getting acne at my age? Isn't acne just in teenagers? Isn't it just in my children? All right, that's a common misconception. The other thing is if I eat too much greasy food, that's going to aggravate my acne or cause it because I've never had it before. The other thing is only oily skin people will get acne, which is not true, right? So those are some of the most common misconceptions. Also, the misconception is if I pop them, then I won't get any more, and I'm going to heal them, and I can just do it with over-the-counter skincare. That's all wrong.
Mm-hmm. Yeah. I'm glad you brought up the point of diet and acne.
Oh,
I mean,
huge.
We get a lot of questions about
Huge.
that, right?
Yeah.
And we know from our medical studies that there are several things with the diet that can make acne worse. So we know diets that are high in dairy, diets that are high in sugar and whey protein can make acne worse. But sometimes we see patients with acne that aren't, eating a diet high in sugar or aren't taking whey protein, and it's not always the diet. I think sometimes that gets blown a little bit out of proportion with the media.
Mm-hmm. The other thing is the hormones.
Oh, yeah.
Those 20, 30-year-olds, even teenagers, they're on the wrong oral contraceptives, the wrong IUDs, intrauterine devices. They're all putting those in young females now. Those unfortunately will aggravate the acne and induce it.
Sure. I see that often. Also the Depo shot I've seen induce a lot of acne as well.
Yeah.
And sometimes I'll have a parent come in, their child's a new acne patient, and their parent is kind of opposed to medications and they just want to get to the root cause of the acne, which is always a challenge because there's so many causes. There's not one, it's not the fact that they're not washing their face enough. Yes, that can contribute, but that is not the only factor. Genetics play a role. As she mentioned, hormones play a role. Yeah. Diet plays a role, your daily routine. So we can control so many lifestyle we can do lifestyle modifications, we can really try to control the regimen throughout the day. But it's hard to control hormones, it's hard to control genetics. Mm-hmm. So a lot of times we have to combine lifestyle changes with some of our very good, very safe medications that we have.
I think genetics is really huge and important. I'm glad you brought that up because that is really important. You look at the mother or the father and say, have you ever had acne? Oh yeah, I was on Accutane. So if the parents had acne and were on Accutane, that child has a severe problem. They are very, very susceptible to getting the acne because of the genetic profile. Yeah,
absolutely.
That's a good point. Yeah.
And for patients out there, I think it's important to know, yes, we can give you, a daily routine, some lifestyle changes to make. We have very good topical medicines available now. Mm-hmm. There are oral medications, we have several of them. We also have medical devices, like I mentioned earlier here at Trillium Creek, we have a laser called AeroLase that we can add to your topical medicine or we can add to your oral medication and that laser is very safe, really no downtime. And I've seen great results with it.
Yeah, I agree.
And then our very strong kind of big gun medication we have for acne is called Accutane, and Dr. Torok mentioned that. And Dr. Andrasik, I always hear parents are fearful when we mention Accutane. There is a stigma with the medicine. Can you speak to that a little bit?
Sure, yeah. I always like to counsel in depth about Accutane. I always tell them that it's our most effective treatment for acne. It's the closest thing we have to a cure for your acne, and when done in a medical setting is very safe. It's basically vitamin A in a pill, and what it does is shrink down the oil glands. There's a few things we have to make sure we're watching out in the patient's past medical history, make sure they don't have inflammatory bowel disease, or history of severe depression and things like that. But I would say that in most patients, it's very safe, it's obviously very effective, and most patients are very happy when they're done with the course.
And the nice thing is it's only usually a 5-month course. And you can, in young men, especially the males, right, you can pretty much say, you're going to be clear. 90% of the patients will clear in 5 months.
Yeah.
And you won't need a repeat course, and you won't need anything further Females are a little different because of the hormones, okay? So you then have to moderate the hormones and make sure it doesn't recur. Yeah.
Exactly, agree. And I oftentimes use that phrase as well. It's the closest thing to a cure that we have. And if it's dosed and monitored appropriately and you're seeing a provider who's comfortable prescribing it, it's extremely safe. In my opinion, safer than being on antibiotics for
Yes.
3, 4, 5 years.
Yes.
Well, you know, Acne came out in 1987, right? I mean, I remember my very first patient I put on Accutane. Back then, you did blood tests every month. Now it's, you know, we're more comfortable with it. We know what to expect. To me, it is almost like a miracle. That's what I tell patients. It's just their quality of life, self-esteem just soars.
And like you said, I think it has come a long way. Oftentimes I'll see parents who are on Accutane and maybe had a bad experience. It was dosed too high or whatnot, but we know that a lot of the side effects are dose dependent. So I think that in general we've lowered the doses somewhat now to make it more tolerable for people.
Yeah.
And I completely agree with both of you. I agree, it is a miracle.
It truly is.
The before and after pictures are incredible. And I won't say always, I very often hear the phrase when I show those before and after pictures to the patient or their parent, I always hear, I wish we would have done it sooner.
Right.
Do you hear that?
Right, always. Oh, I don't remember it being that bad.
Yeah.
So the pictures are, you know, what we always take because that it just speaks volumes. Yeah.
And Dr. Andrasik mentioned the issue with depression because a lot of patients and parents are worried about that. It's extremely, extremely rare. And there have been really large studies looking at thousands of patients who have been on the drug. And the general trend actually is that your mood often will improve on the medicine, which makes sense. Your skin is clearing, you're feeling more confident. And a lot of my Accutane patients, as I see them, their skin's clearing, they have a smile on their
They have a big
face, they're
smile.
more confident, they feel great.
Right. You
So-
look at the original picture there,
Right?
and then you see it halfway through there.
Exactly.
You know,
That's so
it is.
true.
It really is true.
It's great.
Yeah,
I mean,
yeah.
studies have shown acne can cause depression and anxiety. It worsens the mood. So if we can clear it with Accutane or with Aerolase or with our topicals, patients are happier and more confident. So
And you've made a difference in their life.
you have.
Huge difference. Huge difference.
Those are some of my favorite patients. The
Yeah.
ones who come in and are severely, cystic acne, or the patient's head to toe covered in psoriasis, and we can put them on Accutane and clear their acne, or we can put them on one of our biologics and clear their psoriasis. It's life changing. So those are some of my favorites, the most rewarding patients for me.
Exactly. Yeah. That's why we still do it every day.
Yep.
Yes, exactly. Well, very good. I think that concludes our discussion. Thank you all for being with us. Again, that's Dr. Wyatt Andrasik and Dr. Helen Torok. I'm Dr. Matthew Reedy with Trillium Creek Dermatology. Feel free to visit us online at tcohio.com. Give us a call, 330-725-0569. Thank you.
Thank you.